We are here again in SNB Aesthetic Clinic with our plastic surgeon, Dr. Hossein Abu Khalil. Welcome.
Hello again.
So, about the breast augmentation and butt augmentation, uh, using the autograft fat or implant, what you say?
Autologous graft, fat graft is a solution, but there is not a standard or a universal use for autologous graft in breast, because in breast we usually use it in a limited indication, and usually we do a hybrid. We use an implant and we complete the shape with that fat. For the butt, it's different because we, as a surgeon, I prefer the fat grafting for the butt instead of implant. It's a big difference because when we put the implant in the breast, we feel like we're placing the implant in a good place, in a good plane, and the risk is minimal. In the butt is not the same. It's not an easy recovery. It's not actually a very comfortable operation for, and that's why, and for the longevity of the result, for the butt we prefer the fat, for the breast we prefer the implant.
And sometimes a skinny patient comes and they are asking for autolog fat transplant to their breast, but I mean they don't have any extra fat.
How can you use what you don't have?
Yes.
You don't have fat. How can we use it? So we need to explain to that patient that whenever we transfer fat, we prepare that fat very good, and then we have the chance actually to have a result with 45 to 55% of the whole quantity of fat transferred in
Harvested,
that.
yeah, yeah.
Exactly. And then if the whole fat that we can take from your body is about 100 cc, what can we do with this? Nothing. So we need to understand that what we use is what we have. And if you don't have enough fat, you can go for another option.
So could you just make it clear for me as well? This is important
Yeah.
for me too. So for example, when you harvest, when you take like 100 cc fat from body, wherever, so how many ml you will inject, re-inject?
Actually, we lose almost half of them because we have the liquids that will be taken away, and then the fat, the full amount of fat, the pure fat that will be injected will not be there 100%. Will not remain 100% with that volume, with the initial volume that we get after the surgery. And that's why we always have to tell our patient that we may need top-ups, we may need to retouch, because we usually lose almost half of the amount. With the new technology, with the new preparation, it's much better. We are saving almost 70-75% of the fat, but it's never 100%.
And you told me about the top up. Do you keep the same or you have to harvest again?
I know a lot of people who are actually using the same fat, but I prefer to have a fresh fat every time.
That's good. Thank you so much. And about the mommy makeover, we have lots of clients. They come back after giving birth and they want to get back to their normal shape. They need like a breast lifting or the abdominoplasty to lift the skin. So they always ask what is the downtime and what is the instruction after surgery.
Instructions are almost same for everyone. We all know that abdominoplasty is a very tricky surgery, and you need to listen to your doctor. And whenever I say that you need to avoid any exercises or any weights or any exposure, sun exposure, or any exposure to high temperature and low temperature, you need to answer, because you will shorten the recovery time if you follow the instructions. For breast, it's a little bit of difference between the one who had a retropectoral, that means below the muscle or above the muscle. Because whenever we don't touch the muscle, the recovery time and the pain is less. Whenever we go under the muscle, it's a little bit painful in the first 2 3 days, and actually the limitations are bigger because you need to avoid any exercises for 1 month. You need to avoid any upper body exercises for almost 3 months, and that's why there is a difference between the patients. We actually, it's individual. We take every case and we study the case and we know what we did in the operation, and we give our patients the right indication and the right instructions.
Perfect. So we are talking about like 1 month to 3 months to get back to normal activity, yeah?
It depends what kind of activity, what kind of
Normal,
work
I
they
mean,
do.
yeah,
And in
usually.
a normal case, 15 days are enough to go back to work, but it's not enough to start a normal life, a fully normal life.
Okay, perfect. Thank you so much. We will have a lot more question for you, but thank you for today.
Welcome.